Welcome back to Tune In and Tune Up, and we want to reach out and touch someone today. In fact, we're going to take a look at massage therapy, certified massage therapy. We're reaching out to Touch Techniques with Mr. William Prescott.
Hi.
Mr. Prescott,
Hey.
it's good to have you with us.
It's good being here.
Now, when we talk about massage therapy, what's the difference between a certified massage therapist and your traditional masseuse?
Actually, there's no difference, actually.
There's no difference?
There's no difference. A massage therapist and a masseuse or masseur are the same. The reason why you have the title massage therapist is because they want to get away from the gender differences, where you have a masseuse being a lady and a masseur being a man.
Okay.
So they came up with the title massage therapist because it's gender neutral.
Okay, so it covers
So
everything.
cover both male and female.
What got you into massage therapy to begin with?
Well, actually, I started when I was at school, 16 years old. And one of the guys from the football team hurt his leg. Mm-hmm. And he came to me and asked me if I can help him. And I think he knew exactly what I had in my bag. I had a tube of Bengay's balsam in my bag. Back in the day, we used to call it Benji's balsam.
Yes.
And I proceeded to put it on his leg, and I started massaging his leg and stuff. And after 10 minutes, he said the pain was gone. So it started back then.
So you naturally had this affinity
Apparently
to
so.
working with people and,
Yes.
and healing, because it
apparently
requires
so.
a certain amount, a certain sense of touch,
Yes.
and a certain amount of, I would like to say, gentleness. Of course, there are other areas that might require
Knowledge of human anatomy and physiology, yes.
Exactly. So when I consider going to a massage therapist such as yourself, what are some of the possible issues or complications I might be suffering with?
Well, one of the things I do with my clients when they come in, we sit down, we have a little chat, and I try to find out from them any pain issues or discomforts that they're experiencing right now at that point in time. And then I do an assessment. I do two assessments: a standing assessment to see how the spine is in alignment with the hips and everything, and then I do a lying assessment where your body's in a neutral state, where you don't have the influence of the legs standing on your feet affecting your pelvis and your spine. And then I do an assessment to see whether you have any spinal misalignments, your pelvis is straight, you have a leg length difference, things like that. Check your neck to see if you have any misalignments in your neck and things like that. And then I discuss it with you further and let you know, well, this is what is required, treatment. And then you will give me the okay, yes or no. You don't want to get the treatment, but most of the time the people say yes, they want to get treatment, get the real limits done.
Let's be real here. A lot of us, men and women, find ourselves inclined to seek help after things have really become unbearable.
Yes.
What are some of the challenges that you're presented with?
For the most case, men like to live with pain. Men usually tell you, well, see this pain, I can deal with this. And the guys usually only come to the office through the prompting of their wives or girlfriends, or when they wake up in the morning and find that they can't move, and it's a crippling pain, they can't move. So then they want to bring on heaven and earth to get treatment done. Women, on the other hand, women are the first sign of pain or discomfort. Women call and they make the appointments. But then when people come to the office, some of the challenging things I find is I sent you a photo today.
Yes.
Of a guy. He was in his garden and he was just pulling weed, and he threw his back out.
He looked lopsided.
Yes, he was twisted really bad, leaning really bad to the left. It caused his right hip to come up because he could not put his foot flat on the ground, and it was leaning to the forward, anterior. So he could not straighten up both backward, and he couldn't come to the right. He couldn't straighten up to the right.
Wow.
And that took me 2 months to fix.
2 months.
2 months.
And how many sessions would he?
Once per week.
Once per week.
He came to me every Friday, as far as I can remember.
Wow. And I'm seeing him, looking a lot
He's
more
a lot better than
limber.
that right now on the right. He's a lot better than that. No, he's back to normal now. He's back out working.
Wow. Wow. So when we hear a lot of these fancy words like myoskeletal alignment therapy,
Yeah.
that's a lot of medical language. What does it really mean? And when is it that we need myoskeletal alignment?
Well, let me. I made some notes on it to break it down for you. Myo just means muscle,
Okay.
and the word skeletal is related to muscle, to the skeleton and its function. Alignment is just the arrangement in a line or correct positioning of both the muscle and the skeleton. So myoskeleton is just getting the muscles and the bones back into correct balance and function. That's basically it.
Well, based upon that photo alone that you've shown us,
Yeah.
he wasn't, to my mind, doing anything that was overly arduous. He wasn't lifting weights. He wasn't moving something incredibly heavy. Is it easy for you to get yourself out of alignment?
I think in his case, he might have had an existing problem because he's involved in construction.
Okay.
And as I said, men go around with issues and they don't address the issue until it gets really bad. I believe he might have had a misalignment already in his lower back and just bending over and probably pulling the weeds, using bad technique in pulling the weeds, bending over badly, and cause his pelvis to drop and his spine to shift.
Wow. How important is that? Because this is not the first time. I think I've heard you mention spine and spinal at least 3 times already.
Yes.
How important is the spine being aligned to the rest of your posture?
Be honest with you, the spinal column houses your nervous system, the spinal cord. And the nervous system is the master system of the body. It controls everything either directly or indirectly.
Okay.
And if you have a misalignment anywhere along your spinal column from the neck down to your sacrum, you can have a misalignment. Nerve roots coming out from your spinal column could be pinched, or you can have parts of your spinal cord being pinched. And wherever that nerve is going to in your body, you can have glandular, organ, or muscular dysfunction, which is really bad. And so I always stress that people check themselves in the mirror, look and see if you have your shoulders are balanced, check your legs and see if one is longer than one, shorter than one, and then seek the correct medical help.
How easy is that? Because to be honest with you, we tend to see in the mirror a vision of what we expect. And oftentimes, you don't see what is really there until it's, gone way past the goalpost. So what are some of the things that we should be looking for?
Well, if you can't do it yourself, you can always get an objective eye. You can get somebody else to come and check for you. There's some ways you can check it out. You can sit on the floor with your back against the wall and get someone to come and check your legs and see if one is longer than one. Because once your back is against the wall, then your pelvis is aligned to the wall, flat, and then you can see if one leg is longer than the other. Similarly, if you stand in front of the mirror, obviously you can check if you can put a line across the wall behind you at shoulder height, and you can check and see if your one shoulder is dipping lower than the other and things like that. You can check your neck and see if your neck is tilted. If it's tilted, then you know you have a misalignment.
All right. Yeah. And misalignment is something that can occur in
very easily.
So all ages, basically.
All ages, very easy. You can be sitting in your chair, and research have shown that if you adopt a bad posture, that's not ergonomically sound, bad posture, and you slouch into one side for more than 20 minutes, you can have a misalignment.
Well, I will admit, I naturally lean to the right. Even sitting right now, I'm naturally leaning to the right. Am I putting myself at risk in terms of,
Well, leaning to the right might not be so bad because I'm leaning to the left. But leaning to the right and then shifting your pelvis to the right as well, that's where you're going to get the problem, because you're actually pushing your pelvis down and you're twisting your spine as well. So when after 20-30 minutes you stand, you're going to see then that your pelvis has dropped And what it does, it drops, goes to the right, and makes that leg longer than the other one.
Wow. Let's dip in a little bit to pregnancy. Is massage therapy, especially where we're looking at myoskeletal realignment and the like, is this something that can be practiced during a pregnancy?
Any trimester, yes. And I've been doing it for years.
Wow.
I have actually had a client, an officer of the court. So, you have to be very careful, the officer of the court. But she was due to deliver it 2 weeks before, after the session that I gave her. So 2 weeks later, she had the baby. But I went to her residence and I did the realignment on her back. But instead of putting her to lay face down, I put her to lay on her side, and I did the techniques on her side. Put her on her back and realigned the hip from the forward position, the front position, and she was good after that.
Oh, wow.
But she was complaining of a lot of back pain.
And was this something that she suffered with before the pregnancy, or this?
No, because she was a patient of mine before the pregnancy.
Okay.
So she would have been familiar with, misalignments and realignments and stuff like that, because she was coming to me before, she and her husband. And so when she had the misalignment in her back, she felt it. It was very, very uncomfortable, because with the distended stomach now, it's going to cause further curvature of your spine.
Yes.
If you have a misalignment in the spine, you're going to have more pain. Once you have that forward push like that, you're going to have more pain in your spine.
You mentioned about posture. You often hear your parents, your teachers tell you, sit up straight.
Yes.
No slouching. And obviously there's a reason for this. Does our furniture also contribute to some of the problems that we might be suffering with?
Yes, they can. Yes, they do. I found that recently a lot of furniture manufacturers are leaning more towards aesthetics, rather more so than comfort. So if it looks nice in the decor and stuff like that, it fits well in there. But then you got to look at the comfort, especially on beds as well. So you might have a piece that might be really, really soft and comfortable to sit in for the first 20, 30 minutes. You're watching the news and stuff. But then when you try to get up out of the chair, you got to rock yourself to get up out of that chair, because the chair is so soft and it draws you down into it. But once your knees go way above your hips, it's going to cause your spine to curve out backward this way. And that's going to make it very easy for the spine to become misaligned.
You know how many TV rooms filled with those couches that are like that? I mean, yes, that are poofy and you just sink into.
And so comfortable, right?
And then the pillow top beds.
Yes. I have a lot of people come into my office that have pillow top beds that experience a lot of back problems.
Well, I haven't experienced the back problem, knock on wood, if I could find it, but I am actually one of those persons that changed out to pillow top. And this is years now. I find myself liking this feel of sinking into the plush comfort.
Legs that are too soft, that will cause problems.
How can we fix this without trying out the whole bed? That is?
I can't really address that, to be honest with you, because my assistant, she had a pillow top bed and she had to flip the bed, because you cannot take the pillow top off. It is actually stitched onto the top of the bed, and when you flip the bed behind there's just wooden apparatus or whatever the case may be. So what she had to do, she had to go and buy some high density foam, 3 inches of high density foam that will match the area of the bed, the mattress, and put a piece of plywood under it and sleep on that. And until the landlord could change her bed.
Wow.
But that was her remedy for that. I had another client, he bought his bed 2 months prior to coming to me, and then to discover that the bed was causing his problem, because every week he was coming to me with the same problem, and the only thing that was common in the equation was the pillow top mattress. He changed the pillow top mattress, and I haven't seen him in a while.
A lot of people have been following the craze of memory foam. Are you familiar with that, Mr. Prescott?
Yes, I'm familiar. I've heard about memory foam, but I don't know much about it, to be honest with you. I've heard people saying that they bought memory foam pillows, and one person tell me they're still feeling pain. But I might think that to my clients or to people that come to me complaining about neck pains and have those memory foam pillows, is that if you have a misalignment already, the pillow is not going to fix it. If you have a misalignment in your back, the memory foam bed is not going to fix it. So you're looking for a correction. For these things to correct your problem, you need to get a manual manipulation first.
Okay.
Get the bones put back in place. Get the muscles to balance out properly, because the muscles on either side of the spine have to pull equally to keep your spine straight and things like that for posture. And if you have a muscle imbalance, if you have a misalignment, you're going to have issues. You need to address the problem first, and then these things might help you, might be an aid in maintaining your posture and balance and stuff like that.
Now, when we hear the word therapy, it often conjures up thoughts of correction, or rather restoration. Are there any possible ailments that we might be going about our day-to-day business and be suffering with and not even know that we're doing more harm?
The first one that come to mind is, well, first two: muscle imbalance and stress.
Muscle imbalance?
Muscle imbalance, yes.
Like one of my biceps bigger than the next. Which is it?
A muscle imbalance can come if, like, for instance, on your spine, people call the chicken bones, the scapula, and the
Back
the
here?
upper part. Yeah.
Okay.
If you have a let's say you have a few of your ribs in those areas popping up and misaligned, you're going to have the muscles around that area swelling, and so you're going to have a muscle imbalance because those muscles are going to be swollen and they're going to be in a spasm. A spasm is an involuntary or uncontrollable contraction, so you're not controlling it. On the other side, no, the muscles are going to be flaccid. They're going to be, not so much in use, and you're going to feel discomfort on that side where the scapula is elevated. Plus, it's going to affect your shoulder, or the function of your shoulder, because it's going to cause your shoulder to go forward, and then you lose range, because once you feel pain too, you're not going to extend that arm anyhow.
True.
Right? So you're going to feel pain. The other thing is stress. My thing is, a daughter told me this once: if you have stress, get away from the stress, or get the stress away from you.
That's
third thing,
easier said than
yeah,
done.
I know, yes. The other thing is, if you can't do either of the two, learn to manage your stress.
Okay.
And that's where we come in. We can help you in getting your those areas relaxed, get the muscles to relax, get the realign the body if there's any misalignments, because once you have a misalignment, once you have a bone out of place, those muscles are attached to those bones are going to spasm.
Okay.
Right? But stress can actually cause a lot of other issues, high blood pressure, things like that. I had a lady who actually, her blood pressure was really, really high because the muscles in her neck and her upper back, her shoulders and upper back were so tight.
I know that feeling. It does not happen often, but pressurized environments, if you're under crunch time, you don't really feel it until after you've actually cleared that hurdle. And then when you go to lie back, you feel this tightening somewhere within this region here.
And it's dangerous.
And that's stress.
It's stress, but it can be very dangerous as well, because you have nerves, some very, very important nerves passing through your neck, called the vagus nerves, and they control your heart rate and digestion and things like that. And that is also controlled by your brain. We don't voluntarily or we don't have any conscious control of those organs. But if you have stress and you're feeling tightness in your neck and misalignments in your neck and things like that, it can affect those nerves, vagus nerves. Tightness in your neck and muscles pulling in your neck can actually block blood supply going to your brain, the back of your brain, and can actually lead to stroke. Wow. So it's very, very dangerous sometimes.
So that's why when I look at the brochure, stress relief is also one of those areas that are listed for massage therapy. Yeah. Because what happens there? The massage does what?
Well, in terms of stress, we do an assessment first, and we do an actual touch or feel test called a palpation. You go through and you feel the area, and you check and see make a mental note of the areas that need the attention for the massage. And then you determine at that point in time what type of massage you're going to do for the person, because obviously if the muscles are very, very hard, you can't do a deep tissue, superficial massage first, and then you gradually increase the pressure. You might need to include maybe some stretching the techniques that you can do to stretch your muscles in the neck and the shoulders and things like that
Okay.
during the massage. So at the end of it, the person has a great sense of the muscles being relaxed. There's a release, and then you increase of blood flow.
All right. Because basically that's what we're trying to get to.
Yeah.
Increasing that blood flow
That's
and having
right.
it regulated
That's
throughout
right.
the body as it should.
Yeah.
I saw on your brochure, I spent quite a bit of time looking at all the various areas that the massage therapist would cover. And I saw sinus drainage. And I thought, what on earth my sinuses got to do again a massage?
There are techniques that you can do. Usually when people come to me to get a sinus treatment, we massage your neck first. And then we deal with the sinus points around the face and things like that.
Okay.
Anytime somebody has a sinus headache, anytime they lean forward like that, you're going to start to feel your head. You're going to feel pressure in your head, yes, and headache. But sometimes if the sinuses are inflamed, it can cause a painful neck.
Okay.
So massaging the neck and then dealing with the sinus points and everything helps to relieve all that.
Okay. I learned something there. I had a question that someone rolled in to me yesterday in the conversation, and it went like this. Touch techniques. I have a stiff neck. I am unable to move without turning the top half of my body. What are some of the possible problems, and can this be remedied?
There are about 3 different things that I can think of right now. In your neck, you have 7 bones, making it the cervical spine in your neck. And she might have at least 2 or 3 of those bones out of position, causing the neck to be stiff and out of alignment. Or once those bones are not aligned properly to each other, you will not be able to turn. Secondly, it could be a muscular problem. There's a muscle called the trapezius, this muscle here on the shoulder.
Right here?
Trapezius muscle. When this muscle is inflamed, when this muscle is sore, it can cause a lot of problems, because up to last week, mine was hurting and I couldn't even look up. And it was just a muscle. I could not move my head.
Wow.
Just a muscle. And then thirdly, you can have muscles, bones in the upper thoracic between the scapula. If you have bones out in those regions, let's say you have maybe a vertebrae from the spinal column or maybe a rib out, it can cause that same trapezius muscle to spasm and cause problems for your neck as well. So the person if the person needs a relief or some treatment in that area, my first line of approach for that would be to do an assessment first and check their range of motion, because I believe they might be able to move more to one side than the other, and then do an assessment on the table to ascertain where the miscellaneous are, to find out where the miscellaneous are, and then do the correction to suit.
There is something very complementary about massage therapy and physiotherapy. Can you make the distinction and then show us how your role complements?
With the treatments that I do is a combination of massage therapy, physiotherapy, and something called Rolfing. Rolfing deals with the myofascia, which is a fibrous tissue that covers all the tissues in the body. And so we cover a broad base of treatments, because you have those 3 in there together. Physiotherapy, on the other hand, well, with my treatment, we do realignments, but physiotherapy don't realign.
Okay.
They don't realign. Physiotherapy would seek to address muscle spasms, stress, any tightness in the muscles and things like that, soft tissue issues, joint weakness issues. So they have treatments that can actually strengthen the joints, restore joint flexibility, restore range of motion, things of that nature.
Atrophy.
Shrinkage of muscle.
Tell us about that. And is there any way to reverse it?
Yes, there is. But it depends on what it is, because if there is a disease that's causing the atrophy,
okay,
like muscular dystrophy, if there's a disease, you cannot reverse it. Not like that. You have to get more aggressive medical treatments or attention.
What?
But in my field, but that's where physiotherapy can come in. Physiotherapists can actually work with the person who has atrophy, like someone who has stroke,
Okay.
and see if they can strengthen the joint. And by strengthening the joint, working on the muscles around the joint to build back strength in the joint. And then also to once you build back strength in the joint, the person can handle more weight. More weight on the muscle, that is stimulus for muscle growth.
Okay.
Yeah.
So, what are some of the causes of the atrophy outside of what you described as a medical condition?
Well, the main one is not using the area, not using the muscle, or not using the joint. As I always say, if you don't use it, you lose it. So some people, when they have injuries, either from a fall or accident or anything like that, they tend not to use the area because it's very painful. What the person would need to do is to seek the right therapy or therapist to get the joint fixed. And by fixing, I mean get it realigned first. So once you get the joints and the bones articulating or working on each other correctly, and then you can work on the muscle, build the muscle back up again.
Okay, so then we can almost get back to
Yes.
pretty much
But it
the
depends,
kind of
because
strength we had before.
if the muscle is not too far gone, and if the muscle is not too badly damaged, you can get back to maybe about 95% of activity and usage.
Wow. My last question or area of questions
Yes.
has to do with athletes. Is the treatment any different for those who are in the athletic field as opposed to, the 9-to-5er?
No, the human body is the same right through. What will be different is the type of injury and the extent of the damage. Because somebody working in the office and they have a misalignment in the back would not be as hurt or as damaged as someone who's on the track running and pull a muscle and fell.
Okay.
Because there's going to be more trauma. But athletes, I think athletes in Barbados need to get themselves checked out more often, and especially before the season starts. Because I've dealt with athletes before at BSAC, and one athlete told me, I asked him how long he had the injury, and this was around March at school sports. He said around September last year he had the injury all that time. So which means he'd been adding insult to injury by running on an injured leg, and he could have made it worse.
So he just dismissed it, or it wasn't paining him as much?
It was paining him, but he's being prompted by coach to run. So he's running. I think these people need to be pay more attention to these injuries and view them as something very, very serious. Because if an athlete has a pelvic region that's unbalanced, or have imbalance in the pelvic region, where you're going to have one leg longer than the other, it's going to directly affect your hamstring. Okay. You're going to pull a hamstring. You pull a hamstring, you got to spend weeks reconvalescing. Weeks. So then that track team go on to Curfton and left you home. So it's best to get these things checked before the season starts, so that when you start the season on an even keel with a healthy body. Even keel.
Everything seems to be about balance.
Balance. That's what it is.
When we talk about
balance.
massage therapy.
Yeah.
So what about pain? Because our athletes obviously work under stress. Is there a particular pain threshold that brings them to the point of, I can't take no more of this?
I think sometimes athletes might push themselves a little too far and cause joint degradation, muscle strain, sprains, and things like that. Because some people can't differentiate between overwork and overload. You overwork a muscle, and you might cause yourself damage. You overload a muscle to a point where you get muscle growth, you get increased fitness, stamina, and things like that. But you got to know how far, for how long. Well, for instance, a runner might be running, and he wants to increase his speed. He wants to increase his time on the track, or the length of time he can run around the track and stuff like that. And once he feels that stitching in his side, he's going to ignore it, and it's very, very painful.
He's going to push through it.
He's going to push through it. Okay. Once he pushes through it, when he comes back to run again, he's going to find that pain is going to start to drift away. That's because you're reconditioning your mind now. Reconditioning your mind. So your mind is now getting accustomed to that level of pain. For him to feel that level of pain, no, he got to push himself even harder, maybe run a little faster, even longer to feel that stitch in his side again. So that's how they increase their fitness level.
How far is too far in terms of the pain threshold?
I think sometimes if the athlete has a competent coach, the coach can see the signs. And the coach should be au fait with these signs. He should be familiar with the signs, because an athlete can damage himself really badly. And I'm talking not just the track and field athlete, but the athlete in the gym as well, weight training, because that's so dangerous. You're pushing yourself past, let's say you're going to 12 reps, you've got 200 pounds on the bar, and you're pushing 12 reps, and the coach wants 3 more, but then you fail at 12, the coach has to be there to hold the bar to make sure that you can push the extra 3 for the 15. But if you find that you're failing at 13, don't force the person past 13 to get to the 14 and 15, because that bar might drop back into his chest.
Okay.
End up getting hurt. So you have to be able to recognize these signs.
Do we also push that pain threshold on regular day-to-day living?
Sometimes. But that's a dangerous thing to do, because if you're not a serious athlete and there's no goal, no reason why you're doing it, I mean, when I say a goal, I mean at the end of it, you're not going to get a trophy, you're not going to get money awards or whatever the case may be.
But can we do it unknowingly?
Yes, we can.
You know, you might have had an injury, soft tissue, whatever, but you've reached a point in your life where you don't really feel it.
And that's the thing. We unconsciously recondition our mind. Because when we get injured and we don't seek medical attention, you don't go to the doctor to get the medication, you don't get the therapy, physiotherapist or musculoskeletal alignments, and then over time your brain gets accustomed to that pain threshold, that level of pain. The danger in that is that you still have a misalignment. It's not been fixed. It's still a misalignment. So you go to the doctor now and you're feeling pain. The doctor is going to give you medication which is going to block the pain being transmitted to the brain.
Okay.
So there's no signal getting to the brain. So you're going to feel now, oh, I'm fixed. So you have a false sense of confidence now, and you go lifting something now and throw that back out, or that body part out even further. When that pain medication wears off 2 weeks later, you're going to be so much pain. Then you're going to run back to the doctor again and get another injection, but you have to give you something stronger. But I always tell people, there's nothing wrong with traditional medicine, with hardline pharmaceuticals. Pharmaceuticals are suited for a short period of time, for seriously drastic measures or situations. What is required, if you decide at that point in time you can't handle that pain, you go and get the medication and the injection, then you come straight to your therapist and get the misalignment fix, so that when that medication wears off, your body's good. Or you get the realignment done, as one client of mine did. She got the realignment done, she went to the doctor and got the injection, and then she told me, William, I'm fine.
So
2 weeks later, she was good.
Follow up. They complement each other.
That's right.
Good points to note.
Yeah.
So your final thoughts for anyone out there who's contemplating, I had these pains, cheese on bread, and it's only bothering me when the rain fall. Hey, call the massage therapist. Do I need touch techniques? Final thoughts?
I think you do. Don't give it a second thought. Call Touch Techniques, 546-7845. Talk to the receptionist. I mean, we are so heavily booked right now, but we'll still try to fit you in. But don't give it a second thought, because anytime you have pain is always a sign that there's something wrong. Always a sign there's something wrong. We are not designed to be painful, but pain is a sign there's something wrong. And if you find you have stiffness, pain, discomfort, you can't bend, you can't move your arm above your head and things like that, there is something seriously wrong. Don't wait until you get to the point where you can't move your hand at all or you can't bend at all. Come and get it sorted out.
You heard it straight here. Have you tuned up as yet? If you need a tune up, make sure that you tune in and tune up right here on the CBC stations of choice. Mr. William Prescott, I think we're going to have a tune up. Yeah?
I'm looking forward to seeing you.